Did you know that prenatal stress and birth trauma are amongst the top reasons that babies struggle in their first few years of life? From colic to constipation, sleep struggles, torticollis, plagiocephaly, and tummy aches, leading into their older years of sensory struggles, ADHD, anxiety. The list seems never ending. What we're seeing today in offices all across the country is that there's always one common denominator on the paperwork. Mom will say, "I was so stressed during my pregnancy," or "I had such a traumatic birth. I remember the doctor having to pull so hard to get the baby out." Other things we've heard is, "I lost a loved one when I was pregnant," or "This is my rainbow baby," after numerous miscarriages. Stress, stress, and more stress. So, how can we help ease the stress for both expecting mothers and babies? Obviously, we can't control what happens in life, but we can control the nervous system being able to work through and process these traumas easier, so that both mom and baby will be more adaptable and resilient to all that life brings, hoping to possibly avoid some of these common symptoms that we mentioned earlier that we see in babies after birth. We are really making this video for expectant parents, those planning to have babies in the future, families wanting more babies, and anyone curious about how they can have the best pregnancy and help learn more about the development of a baby's nervous system. If you're an expecting mom or you want more kids in the future, keep watching this video because we're going to talk about how you can start influencing your child's nervous system even before they're born. We're diving deep into the health of mom's nervous system during pregnancy and how it can influence baby's nervous system and development within utero. You'll learn how the vagus nerve influences your baby's growth, why it matters for long-term health, and how you can support optimal development during pregnancy and beyond. At Harmony, we specialize in cases that involve birth trauma. Sweet babies come into this world and they struggle with colic, eczema, and sleep challenges. We also have toddlers and elementary age kiddos who suffer from these challenges as babies, and then they grow into diagnoses like SPD, ADHD, OCD, ODD, and autism. As we mentioned earlier, in most of these cases, mom had mentioned fertility struggles, a stressful pregnancy, or a traumatic birth. These three things are very likely, especially with how medicalized our country has become with prenatal care. Let's look at some of those stats real quick just to paint a full picture. America spends close to $1 billion on birth per year. 1 in 3 women are having a C-section when it's only recommended and deemed when it's a true medical emergency. 70 to 75% of women are receiving an epidural. 31% are induced. 1 in 7 women are experiencing postpartum mood and anxiety disorders. And the fertility market in 2022 was $7.9 billion, and in 2023 it was $16.8 billion. 65% of women are on hormonal birth control. I mean, come on. We've been so honored to take care of some amazing pregnant moms throughout their whole entire pregnancy journey. That care can even begin before you're pregnant. We have had a few moms start care with us because of either pain, or they had trouble sleeping, poor digestion, or they were just stressed and worn out. Those same moms were having a difficult time conceiving at the time, and they had tried all the things, right? And nothing seemed to help. Within just a few short months of being under care, those moms got pregnant. These moms couldn't get pregnant not because their bodies were broken, but because their nervous systems needed to work better so that their bodies could work better. We had a couple who had 3 kids. They tried for years for a 4th, and they finally accepted being a family of 5. Just 4 months after starting care, Brianna was pregnant. You know, I gotta tell you, I'm so grateful for emergency medicine in the US. We are the #1 in the world for emergency care. But unfortunately for maternal and infant outcomes, we rank dead last. Again, not everything is in our control, but as a whole, something here just quite isn't right. Medical intervention is definitely needed in true emergency circumstances, but not everyone should turn out to be an emergency pregnancy and birth. For low-risk pregnancies, too much interference is happening, leading to a cascade of events that we call the perfect storm, which is all those common symptoms and diagnoses that we are seeing time and time again in our office. So how can we best prepare our mind and body for pregnancy and birth so that we can have the best possible outcome for both mom and baby? Let's go through 4 tips. Stick around because tip number 4 is going to be the most important. Number 1 is empowerment and knowledge. Have you ever heard the saying that birth is 80% mental and 20% physical? When people told me this before having a baby, I questioned them on that But after prepping for birth and studying for it, I can tell you that 80% of it is mental. The 20% comes down to the end when you just have to completely surrender your body and let it do what it was meant to do. When you are more educated, you know more, and then you're able to do better. Tip number 2 is start to prepare before conception. This is for couples who know that they want a baby in the future, for ones who are going through fertility struggles. There is so much that you can do to prepare your body. We call this preconception work. It's doing all you can to be the healthiest version of yourself. We will go more into this in a workshop soon, but you gotta at least 3 to 6 months before you try to conceive, start becoming a healthier version of yourself, both mom and dad. A big misconception is that prenatal life is all on mom, but that's not true. Mom and dad play an equal role, especially in preparing for conception and the fertility phase of it all. You're creating a baby that's half you and half your partner. Tip number 3 is find your circle. This is so important. Surround yourself with people who protect your vision for birth. You want friends and family who are supportive of how you envision it all to go. It's okay to build your boundaries around yourself during this time and say that you don't really want to hear about their birth story if it's not going to be in a positive light. Find providers who align with your vision and answer your questions. You should never feel belittled or irrelevant. Your providers work for you. Tip number 4, nervous system health. And finally, the most important, one of them all. So making sure that your nervous system is adaptable and resilient so that whatever life throws your way, you and your baby can process through it and not store traumas within our bodies, but instead recognize it, process it, adapt accordingly. Let's break it down. Let's start with the most basic understanding. The nervous system controls every cell, organ, tissue, and mom and baby too. A lot of the time, hormones get blamed for everything in pregnancy, from crying to mood swings to more serious topics such as fertility struggles, miscarriages. Doctors love to run the chemical imbalance of hormones. As this is true, then what really is the root of it? What system regulates hormones and decides which ones it needs at specific times? The nervous system. So there is our root. When the nervous system is dysregulated, many common symptoms occur. Cramps during periods, symptoms like endometriosis, PCOS, fertility struggles, miscarriages, pregnancy pains, morning sickness, nausea, high blood pressure, constipation, whatever the symptoms are, we can almost always trace it back to the nervous system. So how can you check if your nervous system is ready to make a baby? Have a great pregnancy and conquer birth and postpartum. The first step is to measure your heart rate variability. We do this at Harmony using technology that's far more advanced than Whoop, Garmin, and Apple Watches, and our Oura Rings. We have gadgets that we use daily, but the HRV test that we're gonna do here in the office is gonna measure how your nervous system is adapting to stress and if your body battery is ready to take on the prenatal season. This will also tell us how your baby is adapting to stress as well. So whatever mom, because they're experiencing whatever mom experiences. We'll also do 2 other scans that will tell us even more about your nervous system. Those 2 are fast and non-invasive. They will tell us how your brain is communicating with the rest of your body, where you are storing and holding energy, and how your nervous system is processing and dealing with stressors like traumas and toxins. The central nervous system is the biggest reproductive organ that we have. It controls all the other organs and hormones and glands, so we need to make sure it's functioning at its best for preconception, pregnancy, and after birth. If you want to see how your nervous system is functioning, DM us and get your neurological scans scheduled right away. That way our doctors can read them, look at your history, and create a customized care plan for you and your baby. We have the opportunity to impact baby's nervous system even before birth, which is wild, and I'm so thankful for that. As we said, we aren't in control of many things, but what we can control is how our nervous system reacts to stress. We can have better outcomes and hopefully avoid the norm that's happening for so many kids today. For more information, visit the link in our bio. Thank you.